బాగున్నారా?
బాగున్నాను
అదే మేడం కనపడలేదు.
యా ఎల్కే కూడా ఉన్నారు.
అవునండి మేడం. మ్యామ్ గుడ్ ఆఫ్టర్నూన్.
యా గుడ్ ఆఫ్టర్నూన్. గుడ్ ఆఫ్టర్నూన్. హౌ ఆర్ యూ ఉమా?
ఐఎమ్ ఫైన్ మ్యామ్.
Yeah.
Thank you. How are you?
Yeah, I'm doing okay. So far, so good.
Madam.
That's great.
మేడం
వినబడుతుందా నా వాయిస్?
వినిపిస్తుంది నీ వాయిస్.
మేడం భద్రమణి మేడం స్టార్ట్ చేసేయచ్చు.
సరే. Shall I start?
Okay, ma'am.
Om Namo Venkatesaya. Good afternoon to all of you. It gives me immense pleasure to welcome all of you to today's webinar. At the outset, I feel proud to welcome the chief guest of today's webinar, Dr. Duguri Jemuna, Vice Chancellor, Sri Padmavati Mahila Vishwavidyalayam, Tirupati. We are happy to have you here, ma'am. Welcome, ma'am. Secondly, I extend warm welcome to Ms.Nandini Tirumala, alumni of our institution and resource person for today's webinar. Welcome, Nandini.
Thank you.
Next, I would like to extend hearty welcome to our Devasthanam Educational Officer. Welcome you, sir. It gives me a lot of pleasure in welcoming our dear principal, Dr. K. Mahadevamma, to this webinar. Welcome, ma'am. I welcome all my friends and colleagues from our college as well as from other colleges and universities in various states of India. I welcome all the participants and organizing committee members, Dr. Umarani, Dr. Kulai Reddy and Dr. Gunrajamma to this international webinar. And I welcome all my friends who are not psychology members. Especially I welcome Ramani from Vizag, and I also welcome my friend Dr. Venkatachalam from Periyar University. Before going further, I would like to say a few words regarding why we are observing World Mental Health Day. We are aware that World Federation for Mental Health has celebrated the first ever Mental Health Day on October 10th in 1992. It is observed for promoting mental health education, spreading awareness, and fight against the social stigma that is often associated with attached to people with mental health issues. It is the day when millions of supporters around the world participate in wellness programs by bringing to attention the major effects and illnesses related to mental health. Each year, WHO puts out a theme for Mental Health Day. You know, last year it was suicide prevention. Before that, it was youth and mental health. This year, we are observing Mental Health Day at a time when our daily lives are dramatically changed as a result of COVID-19 pandemic. The past months are a challenge for mental healthcare workers, providing care in difficult circumstances, going to work fearful of bringing COVID-19 home with them. For government and NGO personnel who put their lives at risk by going out and executing their duties. For students adapting to taking classes from home with little contact with teachers and friends and anxious about their future. For workers whose livelihoods are threatened, especially migrant workers, for the vast number of people caught in poverty. And for the people with mental health conditions, many experiencing even greater social isolation than before. And for people managing the grief of losing a loved one, sometimes without being able to say goodbye. Companies let go of their staff in an effort to save their businesses or indeed shut down completely. Hence, it is expected that the need for mental health and psychological support will substantially increase in the coming months and years. Investment in mental health programs at the national and international levels is now important than it has ever been. This is why the goal of this year's Mental Health Day campaign is increased investment in mental health. Investment need not be only funding. We have to invest more of our time and efforts in keeping our life balanced. You be mindful of other people's needs, extend unconditional support, care, and kindness. Be less judgmental and more empathetic. With these few words, I hand over the mic to the president of today's function, Dr. K. Mahadevamma. Thank you.
Bhadramani. Om Namo Venkateshaya. Good afternoon to all. I am very happy to note that Tirumala Tirupati Devasthanams, W degree and PG College Tirupati, Department of Psychology is organizing a one-day international webinar on making women's mental health a top priority, opportunities and challenges. I welcome the resource person and alumni of our college, Sir D. Jamuna Madam, Vice Chancellor of SV Mahila Viswavidyalayam, Tirupati, and Nandini Tirumala, Mental Health Lead Consultant, Windsor, Ontario, Canada, and Dr. R. Prasad, Devasthanam Educational Officer, Tirumala Tirupati Devasthanams, Tirupati, and Dr. G. Bhadramani, organizer of this webinar, HOD of Psychology, Dr. K. Umarani, Associate Professor of Psychology, Coordinator of this webinar, Dr. L. Kulai Reddy, Faculty of Psychology, Member, and Dr. N. Munirajamma, Faculty of Psychology, Member, and all the participants. I am delighted to say that the Department of Psychology, SPW degree and PG College has initiated one-day international webinar on making women's mental health a top priority, opportunities and challenges. During this COVID-19 pandemic situation, this is a good beginning towards adopting advanced technology, teaching methodologies, virtual classrooms and various e-platforms, which is a novel approach to teaching and learning process, especially when the learners are forcibly stay at home. Apart from Sri Vari Seva, Tirumala Tirupati Devasthanams has established educational institutions from LKG to PG level to impart values among students and expose them to Vedic knowledge. Tirumala Tirupati Devasthanam's management is determined to cater to the needs of the students and ensure them overall development, positive attitude, and employability. This pandemic has thrown open a plethora of challenges to shift from conventional methods to teaching and digital learning. I wish the webinar a grand success and thanks to the resource person, Ms.Nandini Tirumala and patron, Sir P. Jamuna, Vice Chancellor of SV Mahila Viswavidyalayam, for accepting to be the resource person of this webinar. Thank you, one and all.
Umarani madam, please continue. Umarani madam, please continue.
Okay, right. Good afternoon, everybody. I deem it my honor to introduce the chief guest of today's webinar, Dr. Jamuna Duhuru, Vice Chancellor SPMVV, formerly Professor of Psychology, ICSSR Fellow at Center for Research on Aging, Department of Psychology, Sri Venkateshwara University, Tirupati. She was a recipient of AGI Tilak Award, Sandoz Foundation for Gerontology Research Award of NRAM Nations, Switzerland, and many other awards in the field of aging. She is the Best Teacher Award, State Best Teacher Award for the year 2011, Meritorious Teacher Award, Senior Fulbright Award, Penn State University, Commonwealth Award, UK, and she is Visiting Gerontologist Award, Canada. She is trained in social gerontology at the International Institute of Aging, Malta, as UNFPA Fellow, Advanced Training on Gerontology, Research at Gerontology Center, Penn State University, Visiting Scientist at Tokyo, Japan, Honorary Professor and Commonwealth Fellow at Salford University, Manchester, trained in advanced techniques of counseling from Penn State University Counseling Center and Family Counseling at Malta. And the list goes on. She is one of the most decorated person in the field of psychology, and I feel it my honor to say that I am her student and I have studied in the same college, in the same university department as she has, and I welcome you, ma'am, to say a few words.
Ma'am, continue. Ma'am, please continue.
Isn't it Dr. Jamuna who has to?
Yeah, I request Dr. Jamuna to give her message.
Ma'am, Jamna ma'am.
Jamuna ma'am, are you there?
She left, ma'am. Unfortunately, I think network issue.
Shall I call Jamuna, ma'am?
Okay, ma'am.
ఇక్కడ ఉమ్మరాడు సార్ మనకు.
Hello, madam ki permission ఇవ్వట్లేదంటండి. It is saying that 100 members have exceeded, so
ఇప్పుడు జాయిన్ అవ్వమనండి. ఇప్పుడు జాయిన్
Jamuna,
అవ్వమనండి.
madam. Subbu sir,
మ్యామ్ ఇప్పుడు
please
జాయిన్
give
అవ్వమనండి
permission
మేడం.
to Jamuna, madam.
ఇప్పుడు జాయిన్ అవ్వమనండి మేడం.
Hello, Subbu sir, could you hear me?
ఎస్ మ్యామ్ ఇప్పుడు జాయిన్ అవ్వమనండి మేడం.
Subbu sir, could you hear me?
ఎస్ మ్యామ్, ఎస్ మ్యామ్.
It's not, you are not giving permission to Jamuna, madam, it seems.
Now say her to join, ma'am. Join now, ma'am.
She joined?
No, ma'am. Just ఇప్పుడు జాయిన్ అవ్వమనండి మేడం.
Okay, okay.
Jamuna ma'am, please unmute yourself and start your video.
Subbu sir,
Ma'am,
Jamuna madam is getting a message that the meeting has exceeded the participant, it seems.
no ma'am, I think she
She still
joined.
could not enter.
ఇప్పుడు చెప్పండి మేడం, ఇప్పుడు జాయిన్ అవ్వమనండి మేడం.
Hello?
ఇప్పుడు జాయిన్ అవ్వమనండి మేడం, నో ప్రాబ్లం.
Yeah, Jamuna madam has come.
Please unmute yourself.
Yes, I'm here, but because of internet issues, there is an interruption.
Okay.
Okay, we could see you.
Permission from the host. The system says you need permission from the host.
Yes, ma'am. Continue.
Yeah, it's okay. Yeah, and I'm happy that we regained the internet again. Thank you. Can I?
Yeah, you can start, ma'am.
Say good afternoon, namaste to everyone here. Dr. Mahadevamma, principal of Sri Padmavati Women's PG and degree and PG college. Dr. Bhadramani, the organizer of this today's webinar, international webinar. Dr. Umarani, Dr. L.K. Reddy, Dr. Muni Rajamma, faculty members of the department. Dr. Ramana Prasad Garu, Tirumala Tirupati Devasthanams educational officer. And today's distinguished invited resource person and my dear student, Dr. Nandini, participants from various institutions, including my students and our alumni, and dear delegates of this webinar. First of all, I would like to congratulate Dr. Bhadramani, Dr. Umarani, and her faculty members for planning this very relevant, webinar on this day of International, World Mental Health Day 2020. And with the focal theme that is making women's health a top priority, opportunities and challenges. Well, in the opening remarks, Dr. Bhadramani clearly said, in response to the call from WHO, we are observing World Mental Health Day globally on 10th October each year, and with a specific focal theme for every year. Of course, as you all aware, the objective of this, the observance of World Mental Health Day is to raise the awareness on mental health problems and also to mobilize the strengths and supports to ensure the mental health of the population. Especially Sri Padmavati Women's Degree College came out with a focal theme focusing on women's health. Yes, it's very, very important. times to speak about women's health. For this group, I'm sure it'll be like a carrying coal to the new castle if I go into the details of the definition of mental health. What is mental health? What are the important ingredients of mental health? So I'll skip those details and I straight go to whatever I would like to say. See, if you recall the focal theme of this year's World Mental Health Day 2020, it is a very unique one. I'll go into those details little later. This 2020 Mental Health Day observance is very special and unique in many respects. As you all witnessing for the past 8 months, we have been experiencing tremendous amount of stress and many challenges, which are common to everyone, every individual, every family, and every social group, and every nation without any discrimination. It's time that we need to discuss about how to make these challenges into opportunities on various platforms. So this one is a very befitting platform to discuss how the opportunities can be challenges can be turned into opportunities, especially to focus more towards the mental health of women during these pandemic days. These challenges have severe in nature, as you know, very debilitating and devastating, with an significant impact on healthcare, education, employment, economics, trade, international relations, governance, and many more fields. So though we are adapting to new normal patterns of behavior, still the days are very challenging with a lot of uncertainty. Well, this year's Mental Health Day's focal theme, I believe, is increasing investment in psychosocial support amid pandemic. Very rightly, selected theme for this year. It is COVID-19 gave a very special call to all the healthcare professionals, which not only for the physical healthcare professionals, but in specific to mental health care professionals too. See, we've been emphasizing on physical health, choices of best practices of physical health to ensure immunity and so on and so forth during these pandemic days. But there are very few attempts to ensure, what are the best choices to ensure the good mental health practices to ensure, mental health during these pandemic days. In this way, this webinar will provide us a very good opportunity to know about how to ensure those, best choices or best practices to ensure mental health. See, plenty of evidence is to show that people are being subjected to wide range of mental health problems during these pandemic days. So that is from reporting from simple fear, worry, anxiety to chronic, panicky conditions and mental health issues where there is a dire need of, health, psychosocial supports from the mental health care professionals. As per WHO and latest scientific, reports, it is evident that we need to coexist with this coronavirus for some more months, maybe for another 2 years. So therefore, given these conditions, we are pretty sure that there will be a dire need of, increase in the need of extending the psychosocial support services for those who really need of that in the days to come. As I always believe, this COVID-19 pandemic condition or circumstances is more of psychological catastrophe more than the physical health, condition, where a lot of anxiety, fear is attached to or created towards this COVID-19, and it is a very serious concern in many, clients or, patients. I'm sure observance of this, day or, through this webinar is an opportunity for us to discuss the ways through which we can extend our psychosocial services to support the individuals and, especially with individuals with mental health concerns. It is time. I'm also, it's like a call to all my colleagues in the profession that it is time to start, services like online, counseling support services, e-counseling services, or maybe in institutions, face-to-face counseling, situations, organizing e-awareness camps, webinars like this, capacity building workshops or FDPs for young budding psychologists so that we can train the professionals for the cause of this pandemic mental health concerns. So let us respond in a very befitting manner and invest our expertise in extending psychosocial supports to the individuals with mental health concerns or issues during these difficult times. I'm sure we have enough, there is no depth of capacity, there is no depth of, expertise. Only thing is we have to move forward and, extend our help, extend our helping hand to those who are in need in our areas. Thank you, Dr. Bhadramani and other organizers of this webinar for giving me this opportunity to join the psychology family and also to say a few words on this very great occasion. Thank you so much. I wish you a very grand success in your endeavor. Thank you so much.
Thank you, ma'am. Thank you so much for joining the meeting. And with a brief notice, you have you took time to join us. And now I ask Umarani to give introduction of our resource person, Nandini.
Umarani ma'am, please switch on your video and unmute yourself.
Okay. Am I audible?
Continue, ma'am.
Okay. Ms.Nandini Tirumala, Mental Health Lead Consultant, Windsor, Ontario, Canada, has done a M.Sc, M.Phil, and has been active in community-based mental health programs in Canada for more than 20 years. She has developed and provided crisis intervention services and other mental health support services for families impacted by mental health crisis, trauma, and severe stress, such as refugees fleeing their countries for war, persecution, and violence. She has supervised counselors who support women fleeing abuse and violence. She completed her bachelor's at Sri Padmavati Women's College, Tirupati, Masters of Science degree in psychology from Venkateshwara University, Tirupati, and M.Phil degree in clinical psychology from National Institute of Mental Health and Neurosciences, Bangalore. She has taken many professional development courses in Canada to enhance her work. She teaches and trains frontline workers and students on counseling and crisis intervention skills. She is a community advocate and works to eradicate stigma of mental illness in society. She is currently associated with the South Asian Center of Windsor in promoting mental health among South Asians due to COVID-19. I welcome Ms. Nandini Tirumala to deliver her talk.
Thank you, everyone. It's a pleasure and honor to be back to the institution where my journey in psychology started, as that was the first place where I opted to pursue psychology, and to also share today with my professors, teachers from the institution, and also other colleagues on how and what are our priorities when we talk about women's mental health. We all know, as we see the organizers as well as the guests invited, if there was no investment in education for women, we would all not be here today. So the investment that has been prioritized long ago in terms of education has brought women to a state where we are able to help other women through our professional endeavors, by being a support, being a friend, by being a mother. And so the investment has paid results. I'm very thankful to Tirumala Tirupati Devasthanams, as they invested in the college where I am an alumni now, and continue to invest in both the health and educational needs of women in Tirupati. I also see that Tirupati as a city has grown and has shown a lot of commitment to women's health and women's education in terms of even having a women's medical college, which was started to highlight and spotlight the needs and the health needs of women. Today, I will be talking about the most important, and I would call it as it would be an underestimate when we say that women have been impacted by the current situation of COVID, as many of you have just discussed. So let me start out by sharing with you what I think are some of the priorities and why they are essential when we talk about women's mental health. As you can see, the topic is very timely on a very important day that, yes, we need psychosocial support for all those impacted with mental health or mental illness, but we also know that women's mental health needs all the attention that we need to give today. I don't want to go much into the details about it, but it is quite evident that women, as you see globally, have lost income because of this pandemic. That has led to increase in mental health crisis. They have also been impacted because of the workload that they have to take care, both in terms of being a mother, worker, carer, and also balancing all of them. And the whole anxiety associated with the future and what it's going to look like has increased a lot of mental health issues in women. And every nation has seen the risks and are now currently looking at opportunities to invest heavily and support the mental health needs of women. Now, why would we call it a top priority? And we have all heard from others today. The topmost reason is what we have historically faced in terms of girls and women are born into a world of structured inequality, and this continues throughout our life course. We are always felt that we are less compared to others. And so when it comes to resources in the family or even in the society, we have to do with less. And so when it comes to prioritization, women have never been given the priority than the attention that's needed. And as mothers, we all know from studies that the mental health of a mother is very crucial for the family, especially for children, and which in turn affects the future of nations in the world. Because when the children are healthy and they grow in very stable environments with all the love and support, we have better citizens who are able to contribute to societies. We also know that globally there has been an increased participation in workforce. Yes, things have changed. Economical needs have pushed women to take up jobs, and the service sectors, which are currently the most impacted see a very, very high proportion of women as part of it. We are also do not have as much representation in high-paying jobs, which can be protected. Women have long working hours. There is an increase in single parenting because of marital breakdown due to issues which we will be talking later. And we also see that the workplace productivity of women, if it is not prioritized and their mental health needs are not prioritized, it can also lead to disability claims, higher health costs, and disability and dependency in old age. So I hope I have convinced you right in my first slide that women's mental health is everybody's business. It's not just for the women or just for her family or for that community or country. It has a huge impact on every aspect of society, and it is very important that we prioritize that and we try to see what can be done. Now, I want to just give you briefly about my work in Canada. Yes, for the past 25 years, I've been working in the field of mental health. I usually work for programs funded by government, and my target population generally has been vulnerable and marginalized communities, anywhere between the age range of 15 years to 65 years. I have worked with women from 57 countries. As you can see, I always make a list. When I used to work, when I used to be at NIMHANS, I used to make a list of women I used to see from different parts of India. And now I look at the women I see from different parts of the world. Yes, the kind of work I do is crisis, trauma, and solution-focused counseling with many of them, and also develop programs in the community and evaluate and see what kind of an impact they make on women's mental health. For today's focus, I do want to say that the group that I see a lot in the community are the South Asian women. When you look at the map, South Asia is a community, is a group where you have women from India, Pakistan, Bangladesh, Sri Lanka, Nepal, Bhutan, Afghanistan. And then we also have Indians from Caribbean, UK, USA, Middle East, and Indo-Fijians. As a country, Canada is a very diverse, multicultural country. We have people making Canada their home from different parts of the world. And as you can see, India alone, according to the 2016 census, had 668,565 immigrants who made Canada their country. The largest foreign group in Canada is from the South Asian community and mostly Indians. The last 3 years alone, we have seen so many international students from India who came to study in Canada. And I would say that a very high percentage of young Indian women are coming into the country independently to work, to study in these institutions. Now, what we have known so far is that South Asians have higher rates of anxiety and mood disorders. They also have perceived barriers when they go to seek mental health support. And also, they are less likely to seek mental health treatment. Now, that is very something that you can relate to even when you come to look at what things are happening in India, is that as a community or as a culture, we are less likely to seek mental health treatment. And if we don't seek those treatment early, we are now looking at a crisis, a mental health crisis, when things get really worse. Canada has invested a lot in South Asian community because they do see there is a need. They also know that the communities are contributing socially and economically to Canada. And in fact, recently there was about $1 million investment to form a culturally adapted form of cognitive behavior therapy for the South Asian community. What also makes it very important is that we, the South Asians, have a different cultural worldview when you compare with other cultures. And now you know how busy it can be to work in mental health, especially with South Asian women, when we look at the barriers they face and what are some of the things. I would really be excited to hear from all of you in India, the work you do, so we can kind of share our experiences. Now, what is mental health? I it's very important to understand what it is before we say why it is important. We know that the World Health Organization calls it as a state of well-being in which the individual realizes his or her own abilities. They can cope with the normal stresses of life, can offer work productively, fruitfully, and is able to make contribution to his or her community. When you look at this continuum, I really like this continuum. I use it a lot when I do mental health presentations in the community, when I sit and talk to clients and their families about what mental health is, because it helps people to understand that it's not either or situation and that it's a continuum, and each one of us can be anywhere on the continuum at any given point of time. So when you look at the green, it says positive and healthy functioning. Let's call it as the healthy point. Then as you get closer to the red is where we call the problem point. And then we move on and it is a disordered point. And what it tells us is that when you are positive and healthy functioning, you are able to contribute, you're productive, you're happy. There will be a little bit of situations where you're disappointed, you worry, and then you bounce back and you are going on with your life as usual. However, when there is an event which is negative, or when there is something that is impacting on you, both your body and mind, you are there at the problem point. This is where most of us need some support, as our usual coping strategies may not be very helpful, and the people you trust and believe may not be as supportive, and a support from a mental health professional could be useful. And now the reason the problem point is very important is because early intervention here can help prevent the later part when you are entering into the disorder point or a phase. Now, I do want to tell that even if you enter the disordered point, there is recovery and you can always come back to the healthy point or go back to the problem point, or you can go between the three. Because often in the mind of people, it is like if you have a mental illness, you are done for your life. However, when you look at a physical illness like diabetes, people are willing to live with it throughout their life. But when the moment they think of it as a mental illness, they think you cannot contribute and you cannot lead a good life. So it is very important that we, as professionals, help people to understand that with evidence and with best practices and with the kind of progress we have made in mental health and mental illness research, we do see that recovery is possible if you are able to first get the help. Now, often when we look at any mental health approach, we do use, look at it over a lifespan. And now I say it's very important for women because we are super women. We have so many things going on, but when we look at ourselves, we often wonder, how do we do it? Because when you look at all the things that are making us vulnerable to mental health, some of it as a role of hormones, which usually between the age of 13 kicks in and has a very big impact because those hormonal changes continue throughout our life course, and they do have immense importance in terms of how we feel and how our mood state is. We also have to remember that as women, we are different when it comes to how we react to stress, how our personality is, and what we have been told about how we have to behave, which is more of a cultural and social conditioning. Having worked in Canada, I also know that the social determinants of health in terms of where you are born, where you live, where you go to school, what opportunities you get do have a big impact on our mental health. So we cannot undermine the importance of the environment, opportunities, and how people develop mental health issues. We also know that government policies and programs which are women friendly, which are targeted to look at women's issues, do impact on how we can approach our mental health. Now, I have women here from India who I work with from all these three age groups: young women, adult women, old women. And as you see, most of these issues are very, very similar to what you would see in an Indian setup. Because when you start with puberty, there are changes. There is both mentally, psychologically, on your body, and we have certain things which pose a risk for our mental health at each stages. Now, when you look at somebody who has moved to a new country, there are also additional issues which make them have a higher risk for mental health issues. Because when you move to a new country, and if you have do not know the language, you have issues with, let's say, your spouse. You have a sudden loss of status because you were working in India. Now you have no job here. You are now dependent on others to transport you places. You are socially isolated because you haven't yet made friends. Now, all these together puts women at a very high risk. And these are how I get referrals, often from people who say she's having a very difficult time. She's been crying a lot. I see her in my doctor's office. Can you please support and tell us what's going on? Or can you see what's going on? But that doesn't stop there. As I said, as women get older, there are other set of issues for older women, which again puts them at a risk. So when you look at this, we know that women throughout their lifespan do require support for their mental health. Now, who and what are some of the factors that are impacting the mental health of South Asian women here in Canada? And I'm sure you would be able to share with some of our work. And this has been totally based on my work and what I see in the community and what are some of the issues that we are working with. So the top on it is the violence and abuse, both domestic, sexual harassment, intimate partner violence. There are women who have pressures created by the multiple roles, negative life events when there is a loss. I see that when sometimes people lose family in India, they're not able to go there. They are having grief, which lasts long. And then they're not able to continue on their life. And then you end up in having depression. There is relationship background. Parenting struggles, a very big one for South Asian women here. As kids grow in a different culture with different cultural values, we have intergenerational conflicts. We have difficulties, especially when women who do not speak the language and the kids actually learn language faster. There is also a communication gap that exists. And when you have other new struggles, when you are a newcomer to a country, you also experience language barriers, exclusion, and other inequalities that you can see in Canada. Many of you know that worldwide, when you saw the Black Lives Matter, there are similar issues of hate crimes in the South Asian community. I remember when the September 11 occurred, people thought our Indian people or the community was also, were all Muslims and they were going to, and a lot of hate crimes happened upon them. And so a lot of us were very scared about what the situation. So you do see fear, anxiety, discrimination due to this. And we all know that when there is a frequency and severity of social factors, there is also a relationship in terms of how much of severity the mental illness has. And when you are a person who, let's say, is a woman, you're disabled, you are poor, and you don't have a job, as the factors increase, so are your mental health difficulties. So the common issues that we see in the community are mood disorders, post-trauma stress disorder, and usually I see a lot of trauma related to violence and harassment, anxiety disorders, eating disorders, and suicide attempts. and postpartum blues and postpartum depression. This is very unique, as we all know, as women, that when we are having baby or when you are just delivered a baby, things are very rough, both in terms of your hormonal changes as well as your life around in terms of how you have to care. And when you are, let's say, do not have the social supports that you can get, let's say in India, and you're all alone in a place where you have very limited support, people do have difficulties, and we see that coping can be hard, and we see a higher incidence of postpartum depression, because of which they seek crisis or mental health counseling. Now, what is the model that I work with? And I work in the community. I love working in the community. I did want to work with as many people as possible who do not have access to healthcare and other facilities for seeking support. And most of the programs that I work for are for the federal and provincial governments. Most of my clients are referred through shelters, family health professionals, law enforcement, social services, schools. When I say law enforcement, police would say that there has been a problem between the couple, and the husband is currently in the prison and the wife needs support. Can your organization or your program offer support to this woman? We also have universities who refer that there is this young woman who cannot cope with the stresses along with the new cultural experiences. She is struggling, and can you please see her? So this is how women are referred to my program. And we usually run both individual sessions and group sessions. If the wait list is longer, it can be very hard to not support the women who need help. So we also have what is called a weekly wellness groups, where women usually join as they are waiting to be seen on an individual basis or in group sessions. As a mental health coordinators, I have counselors, social workers, youth workers who have to provide support to the whole family. Now, this is very important. When we look at an Indian family or a South Asian family, we know that we cannot work just with the individual who is seeking support. We actually treat the whole family as a client because it has an impact. And a lot of times, women do not even come for appointments if they are not supported by the families. Because transportation is a big issue. Unless you know and you're supported, a lot of women are very scared and hesitant to take a transportation or a public transportation to come to your service. So you need also sometimes the support of the whole family involved, and which means that you're not just helping her, but the whole community. And to show your impact as a program, I have to do data collection and evaluation, because we want to say, what did our program do for these women and what kind of an impact it caused, so that we can see if this model has been useful. Because unless we have research and we have impact of things, we cannot do this. And finally, the community outreach for hard to reach clients. There are women who do not know about you, about your service, that you have this potential. So you have to go and support them. Now, when we looked at women in general, especially when you look at COVID, we know that each one of us is affected by it. Me, you, somebody who is working in healthcare, somebody who is at home. We are all affected equally. But then we also have to understand that there are some people who need more support because they come under the high risk category. We need to outreach and develop and may prioritize them for mental health services. Because here they are, new mothers. Right now in Canada, I'll give you an example. Last week I got a call that a young Indian woman was going to deliver her baby, but because of the quarantine and the flights, the mother of the girl cannot come from India to her help. And she's all alone because she really needed her mother for support. And now she has to go through the whole pregnancy and post-pregnancy care with just her and her husband who's working. So she has to now be alone with this child. So those situations are very, very important for us because there's a very high likelihood that this woman will not be doing well and she might enter into either her postpartum blues could result in postpartum depression. There are women in poverty or living in women's shelters. We have women who have lost their jobs, are alone, cannot live with their families anymore. They are living in shelters. Single women, mothers with kids with disabilities. This is very important. This has been highlighted because when you have schools, when you have services for kids with disabilities where they go, it used to be a source of relaxation for women to focus on themselves. But now in the last 8 months, as the kids are here at home, it has put a lot of stress on mothers who are the primary caregivers for kids with disabilities. So that's again a priority population. And of course, we know that when there is a high rise in domestic violence, women with severe mental illness, women with low intellectual functioning, chronic illness, and abusive situation, they all need to be prioritized. So what opportunities are we talking about here? We know that COVID-19 has brought attention to women. Now we need to utilize the momentum. It's not that after 2 years COVID goes and we are going back to how we do things. We have to understand that if it has brought attention to women's health, women's mental health, we need to see how we can offer the support so that it does not stop now, but it can continue. So are we going to make investments, not just in terms of funding, but we also want to make investments in terms of professionals. We need more mental health professionals. How are we going to get and invest in more? So as students of psychology, if you're listening to me today, I would say that this is a very important moment for all of you to see the value that we as psychologists provide to society and see how you can continue that momentum by pursuing careers, by pursuing training opportunities, so you can support women in the community. I used to teach a 9-month course for crisis counseling, and courses like that I found are very useful. In 9 months, start to end, you are now trained to provide support to a person who is in a crisis or support. So we don't have to think about very long-term masters and PhDs, but you can also start investing in small training courses and small programs which can help people, more people to enroll and offer supports at this time. So I would think that educational institutions would want to pursue funding and research and program opportunities to create more of these kind of programs. We need to look at different groups of women, as we saw, and as I'm following a lot of things that are happening in India about the migrant women, migrant workers. We also see that domestic workers have had a huge hit because of COVID-19. We need to now start looking at, rather than having a one single helpline for everybody, start looking at programs for specific. Because we know that women-only programs are very effective and people do want to talk when they know that they can trust you. We also have to look at innovative ways, and this is very important. When I work with the South Asian community or Indian community, we have a different way of running a program than we would do with, let's say, another Canadian group of women, because our needs, our cultural values, our socioeconomic realities are very different. So you cannot now put everybody in one basket, but you have to try to see how can we actually channel the resources in such a way that women have the safety and security to talk about their issues in different programs. We also have to outreach to healthcare providers. Now, this is a challenge. We have been trying a lot here in Canada, is talk to family doctors, to talk to educational institutions, to talk to employers, to screen people for trauma. Because if you have had trauma, even in the past, it can affect when you are re-traumatized by the COVID-19 situation. So we do see that it is very important for people to screen and ask questions directly related to violence in your life, loss, a significant grief, which has not been resolved, and make appropriate referrals so that you are not re-traumatized by the current situation. And the digital literacy, we know that many women have phones. We know that globally women are now able to purchase phones, but do they all have internet connection? Are they all digitally literate to be able to access the different programs that organizations and institutions are providing online? I'm telling you, it's a big barrier for me here, as I'm currently working to develop a seniors mental health program for Indian seniors here. And one of our biggest challenges is how do we get them to learn how to join online and participate in group sessions. The challenge, it's very important, the magnitude of the issues and diverse needs of the community. We know that how the amount of work we do, it always feels like there is so much more to do because of the magnitude of the issues, and also that you support one group, there are always needs coming out in other because we have diverse needs. Stigma is widely prevalent, very prevalent here in Canada. When you talk to somebody and say you are, let's say, a psychologist or you work in mental health, people are not very comfortable. And even if they have a problem, they're not willing to share with you. They always look at the extreme end of mental illness more than what you are, when we talk about mental health problems. They'll always associate mental illness with either violence, with hospitals, with people who are never taking care of themselves, and people who are walking homeless on the street. So it is very important that that challenge is global. We all experience it, and we have to continually invest in trying to take care of that issue. Gender expectations, women always have a tendency to self-blame themselves for problems. And even if they are not, society or culture blames them. Even if they have been, let's say, raped or sexually assaulted, the blame is on a woman. So when the blame is on a woman, very often people don't share those traumas with anybody, and they experience the mental health issues silently. And one day when it's not resolved, it can end into a severe mental health issue. We need more holistic and integrative interventions, because when people associate medication with mental health, it is a very difficult thing. We need to tell them that there are so many other interventions out there for which we don't need medication, and that medication can also be integrated as you're being supported with your mental health needs. Like health-seeking behavior challenges, again, very hard when you are in a society where you need a man's permission for everything. Until the man realizes that you have a problem, it's significant enough that seeks support, a lot of women don't come seeking help. So you need to educate the men to help and understand what the women are going through. Underutilization of existing programs. A lot of times I ask the woman, you have a problem, do you want to come on at this time of the day? And often they tell me, oh, that is a time when I'm doing breakfast, I get my kids to school. Oh, then after that I do my religious activities, and then it's already lunchtime. And after that, the kids come back from school. I don't know when I really can come. So when you look at a woman's life, it's always, she's like the provider. And so she puts everyone else's interests and needs first and hers at the end. So we really need to try to work around a woman's needs and her availabilities and try to help her utilize even the programs that are available. Social and cultural taboos, again, things such as children out of wedlock, fear about talking that you have a problem because nobody will marry a woman who has a mental health problem. I see that a lot when I work with mothers who come and say, can you please fix her, because I do not want that to be a reason for her not getting married? Because, and should I be telling the family that she had this mental health issue? And I'm sure she's not going to get anybody. So there is this whole social and cultural issues which happen about mental health that people are not that hard to tell that, oh, mama, she has, let's say, diabetes, or she has some disorder related to physical health. But when it comes to mental health, people are very scared of it. Primary health care, they need to have enough time to make the needed referrals. And in general, let's say that the perception and trust in helping professionals is very important. If people do not know what you do and how it is helping, they're not going to trust you for help. I just put a post here of Dear Zindagi. I know that Shah Rukh Khan was a psychiatrist or psychologist in the movie. And, it kind of broke some taboos around mental health and seeking help. But it's also important to know that, not everything there is what psychiatrists or psychologists do. So it is also important that professionals come out and clarify what we do and what we do not do. I have often said, why did you take psychology, Miss? People ask me, why didn't you take gynecology? So there is this whole thing between women is more, gynecology is much more better. Whereas when you're a psychologist, you are now dealing with people with severe mental illness right there. The second thing they say is, oh, how are you going to, do you have the strength to deal with all these people with mental illness? Again, people think when they associate mental illness with aggression, with violence, they think, how are you going to work? So these are prevalent a lot, and I'm here talking about people who have gone to universities, who have, got good degrees, but still the difference between what psychologists do, what psychiatrists do, and how they both work together to support clients is still missing. And it is our job, as students. In fact, I would pose a challenge to many of you students who are out there. Just go and ask 5 people today, what is the difference between a psychologist and a psychiatrist? And you'll be surprised, because we as a profession, we are not very sure about what they do. And when you do not know what they do, then you are going to hesitate to come to them. And when I talk about trust in helping professionals, I'll tell you that generally there is a big mistrust in healthcare in general globally. People are constantly checking. If you get a diagnosis, if you get a treatment, tell me how many of you don't go and ask another doctor or another healthcare provider for a second opinion, third opinion, and people are constantly, shopping and, trying to see. So there is this credibility that we have to establish in the community, that we are there to help them. We are there to provide evidence-based support services, and they can come to us. And just because a psychiatrist said you have a mental illness, now if you stop going to that person for treatment, you are actually doing a disservice to your own mental health. So what are my learnings, which I want to share with you? Please listen to women. When they tell you something, whether as a friend, as a colleague, as as your domestic worker, please listen to them and try to see what they're trying to say, and please support them. And if they are willing, please recommend them for available supports and services in the community. Learn and hear from other women survivors who are brave enough to come and talk about their mental illness with others, about their mental health struggles. I see a lot of Indian celebrities coming up on Twitter and this, sharing their stories. If that's helpful for others to also share theirs, that's great. But we have to always say that it has to be done the right way, so people are going to learn from it. Build on the strengths and resilience of women. We all know that in spite of so many negative events, women have an inherent capabilities to cope and to move on. So build on those when you are working with them on a one-on-one setting or when you do group programs. Prioritize workplace mental health, very important. Women are now so much out there. They spend more hours in workplaces than they're spending time at home. So if the workplace is not conducive to promote their mental health needs, they are either going to stop working, and if they are experiencing, let's say, sexual harassment, bullying, and other kind of oppression in workplaces, that can also prevent them from seeking help and instead just stay home. Please conduct community outreach to hard to serve groups. Replicate models. Anything that has been successful women, please share with one another so we can replicate it in other parts of the cities, other parts of the country, and also globally. Involve men in gender equality and women's health issues. Again, a very important. If women are not on the same page as men, if men are, are not on the same page as women in terms of for gender equality, a lot of the progress that we are making and a lot of things which we make, let's say in the sessions or the work we do. I often tell women, okay, you have done all this in my session. How are you going to go and do it, at home? Not easy. And I accept it. I do tell them that, yes, it's not easy, and you need to have them to support you. And often I ask the men to come and see me as well. And it has not been always very readily and agreeable, but it is very important for their women's mental health or for their children. Many of us are employed here in healthcare, women, because of which, as we know, healthcare workers globally are currently under immense stress of not only managing their mental health, as well as mental health of the family and everybody. So please take time to take care of your mental health. As the workload increases and we are listening to stories of survival, stories of trauma, stories of grief, it is very important that we also pay attention to our own mental health and make sure that we are not resulting in compassion fatigue or burnout. I do want to point out that social media is now the other major issue which is hurting young women. I see that here in our young South Asian women, the pressures leading to low self-esteem, depression, suicide attempts, a lot of cyberbullying, human and sex trafficking online is on the rise. Young women or youngsters in general are replacing real conversations with texting. I see a lot, when I see young women, they don't talk to me. They'll come and show me some of the texts they receive from friends, and they say, what did this person mean? What did that person mean? Because they're not able to even have and clarify intentions through a reasonable conversation, but they're constantly trying to read what the other person is saying through text. And because it has impacted their social skills, they have inadequate sleep and exercise because they're constantly on social media, trying to see what the other person is doing, severe body image and eating problems we are seeing. So please, this is very important for your health. If you're young and you're listening to me, I do want to say that please remember that it is great to be connected with others. It has a lot of benefits, but you also have to see that it can hurt you if you're not very careful. So as when I work with them, I see, and it's very hard for me. Look at all the emojis there. I probably recognize a few of them when I am texting, but when some people send me some emojis, I don't even know what they're meaning or what are they trying to share with me. And I should actually follow up with a call to say, what does that mean? Because I am not very sure if that's what they intended to tell you. And people are breaking up and people are having such severe challenges just trying to communicate through all these different ones. So please make smart choices. We all know that no health without mental health. If we don't feel good, it's going to affect every aspect of your other physical health. And we have seen the burden it can have in terms of chronic illnesses later in life, especially in countries like Canada, where we are publicly health funded. The more health issues, the more we have to spend on healthcare. It makes us sensible and smart to invest in early so that we can prevent severe mental health issues later. Early intervention can result in positive outcomes. The earlier you find something, the earlier you try to do something about it, we can prevent a major health crisis. We have all seen when it comes to COVID, what we are experiencing. Countries with very difficult healthcare systems are actually in a crisis. Skills development, get women to learn different skills such as communication, confidence building, self-esteem development, because it can protect her when she faces adversity later in life and she doesn't have to crumble or enter into a crisis. Men have to be allies. So it is very important that every time we talk about women's mental health, we also include men in the conversation. Without political will, we can't make changes. So we have to have the right people to support the initiatives and the mission in terms of women's mental health. We have collaborations, like when you look at somebody even like Tirumala, Tirupati, Devasthanams investing in health, education, those are some great collaborations where it doesn't actually have to always come from, the government. We have to be very innovative in trying to look at other sources of funding to support the mental health needs of women. Culturally relevant models. We cannot bring a Western concept and put it in a community where, people have very different needs. So we have to constantly tailor. And I see that, there are a lot of NGOs doing tremendous work in India, as well as here in terms of developing locally relevant models, online digital support services, apps have come up which are supporting, but we also have to see how much of a reach they have to the people it's intended to. So let's make a smart choice to make gender equality a priority, because without that, we cannot talk about other issues, facing women. So I have a message to all women who are listening. Having a mental health problem does not have to make you weak, shameful, burdensome, or less of a person. You deserve care, support, and compassion. So please seek help. You are important. And as when you look at Tirupati, we have Goddess Padmavati, who has her own temple. We worship her. We go to her. We would expect that the same attention, importance is given to all the Padmavatis or all the women in our lives, where we take special consideration on what their needs are. Thank you very much again for inviting me today and sharing some of my experiences, learnings, and I'm looking forward to hearing from you. Thank you very much.
Thank you, dear Nandini, for your excellent lecture. And it is very pertinent and very apt. And the students, not only the students, all the participants will be benefited by the information you have given. You stood as an example to our students. They are in great awe of you. Thank you so much. In spite of this time difference, you could take your time and attend to this webinar. Thank you so much, dear Nandini. Thank you.
Welcome.
Now the session is open for interaction. I ask Dr. Kullareddy sir to open the session.
Kullareddy sir, please switch on your video and unmute yourself. Bhadramani ma'am, meanwhile you can continue the session, question and answer session.
Okay, sir. Dear participants, if you have any questions, please address them to our resource person, Nandini. Please raise your hands. participants, please unmute your audios and ask the question.
Venkat Lakshmi ma'am, please unmute yourself.
Madam Nandini,
Yes.
Madam, your presentation today is thoroughly professional, scientific, comprehensive, clear and lucid, madam. It is
Thank you very much.
supported with evidences from 20 years of your experiences. You have presented the various cultural, social and economical problems faced by Indian women diaspora in Canada and the support provided by experts like you in Canada and other places to overcome these challenges and lead a happy and successful life. Also, you have touched the importance of making small choices in life, like developing communication and developing self-confidence and the role of men and family and society and government in women's life happy and successful. Thank you very much. And I would like to ask one question, madam. How do you see our women? Are they better placed compared to European women in facing the mental challenges? As an expert, as a person guiding for 20 years with these issues, what do you think of our Indian women?
In terms of the actual prevalence, I would say that the women in both the European, or I call them as the mainstream Canadian women, as well as the South Asian women, they all have similar rates of prevalence. But the barriers that South Asian or Indian women face because of the socio-economic and cultural issues, seeking help, there is a big difference. You can see a Canadian woman calling me easily and saying, I need to talk to you. But when you have to look at a South Asian woman seeking support or help, we see that there is a big, wide gap. So it is very important, and that's the reason that unless we know the real rates of people seeking help, it is very hard to say how many of them actually have a mental health issue. And that is what we are facing here, because there are people now, for example, silently experiencing it. We have a lot of calls from mainstream Canadians who seek support on our helplines, but not as much as women, let's say, from South Asian cultures. So unless people come and we see them and we are able to support or provide healthcare, we are not able to statistically say how much or how many women are actually affected by, let's say, a mental health problem or a mental illness.
Thank you. Thank you. Now I request Harita, please.
Harita ma'am, please unmute yourself.
Namaste ma'am. Hello. Namaste ma'am.
Yes.
I got a detailed explanation about these mental issues and all the things what women are suffering nowadays. And can we have a counseling session like that regarding these issues, what we are facing in houses?
So are you looking at counseling availability in India, or can you clarify your question?
In India, we are not supposed to go to counseling like that, what you have said earlier. So can we have a online counseling sessions like that?
Well, if it is something that there is a need, of course, we can, have more educational, sessions on the mental health needs of women in terms of what they are. But I'm sure that there are enough supports and services in India, and I would really encourage you to look for some of them within your community, within the city. But if there is a need, for sure we can look at some opportunities to see how we can develop something like that. Thank you.
Thank you.
Hello, I request Kirti Pennagandam to come out with her doubts or any interaction.
Yeah, ma'am. Hello, ma'am. Good afternoon. My name is Kirti. I'm pursuing M.Sc Psychology in SU University. Ma'am, could you please suggest your experiences regarding the eradication of stigma of mental health?
Sure. Thank you very much. That's a very good question. Stigma is so prevalent, here as well, even in the, when we call them as Canadian population, as well as when I work with women, as you see from different parts of the world, mental health and mental illness has a lot to do with ignorance. So it is very important that when you do any kind of a stigma campaign, we always have to involve clear, education activities that tell people what mental illness is, how does it come, what is the, evidence, what are some of the factors which affect it. Because often the reason we have stigma is because we are afraid of the unknown. We don't know what the person is going to do, what is going to happen, what their future looks like. So when I do anti-stigma campaigns here as part of my program, we are always trying to tell people the continuum, trying to tell people that this is how it can proceed, or sometimes it could go the other way and it comes down. These are some of the treatment or therapies available. And this is what you can do to protect your wellness. Because often people think that, you cannot actually control your mental health with your efforts. So we do a lot of work on how you can promote your mental health, your wellness. And if something happens because of, beyond your control, or it has affected, these are some of the availabilities. And so when you do a stigma campaign, it is always important to create opportunities for people to ask you questions, to be able to clarify, because people's idea of mental health comes, a lot from, let's say, Hollywood, Bollywood, other woods that we have in communities, because people don't really have one-on-one interaction. In fact, when I work with students here, that's one of the things I tell, that everybody should make efforts to interact with a person who has had a mental health problem, to actually see that they have a good quality of life, they can still work, they can get married, they can contribute to society. And it doesn't have to be that because you now have a diagnosis or you have a condition, you cannot actually, do anything in life and you have a long-term disability. So any stigma campaign, it is very important to also bring some survivors who can share their stories, as well as evidence professionals who can share evidence from their work, so that communities can actually engage in a conversation about it and learn from it.
Thank you, ma'am.
Welcome.
Any participants would like to give feedback, you're welcome, please. Participants, please raise your hand if you want to give feedback, please. S. Lalita. Dr. Lalita from Yogi Vemana University, please unmute and join.
She's unmuted, ma'am. Lalita ma'am, please give your feedback. You are unmuted now.
Hello.
Venkatalakshmi ma'am, please carry on.
Yeah, ma'am, your presentation is really excellent, ma'am, and it's very focused, and you have thrown light into so many pertinent issues, and you have shared your expertise with us. Thank you very much.
Thank you. Welcome.
Lalita, please unmute yourself and join. Subbu sir, connect Padmaja, G Padmaja. She is waiting.
Yes, ma'am. Yes, ma'am. Padmaja ma'am, please unmute yourself.
You have to unmute her, sir. She could not, it seems.
Just now unmuted.
Good afternoon. Good afternoon, ma'am.
Good afternoon.
So first of all, today I want to congratulate the Department of Psychology and Sri Padmavati Women's College and the Tirupati Devasthanams management for giving an opportunity to have this excellent webinar. And also, I'm so happy, ma'am, to hear the various issues on the mental health, and especially in this context, I want to congratulate Dr. G. Badramani. She has paved a way from India to Canada regarding these women's mental health, and what I feel that it is very important, and there are number of problems which are hidden and which the women could not come out due to number of issues. So all these things you have very much highlighted, and you have suggested number of ways to come out of these particular stigmas, etc. And really I enjoyed this webinar, ma'am. And what I want to say is that your information, whatever you have given in this webinar, it has reached the heights of the women's mental health. And the women who have participated in this webinar, they should try to be self-boosted. I think so they have self-boosted by this webinar, and we will definitely guide the other women in their mental health aspects, and we will try to be have a good mental health, and guide the other women in and around us to have a good mental health. And definitely the psychologist and each and every woman who have participated in this seminar, I felt this, we are totally enriched with your speech, and really I congratulate and I appreciate you, ma'am, for participating in this fascinating webinar. Thank you very much.
You're welcome. I'm sure there is enough talent and passion. And if it has been inspirational today for all of us women to talk about it, it is important that we take this to the next level and try to reach as many women as possible, and to ask them to prioritize themselves
Definitely.
when it comes to, the health and mental health.
Definitely. Thank you, ma'am.
Thank you, Padmaja, for your sweet words. Subbu sir, please allow Aparna.
Aparna ma'am, please unmute yourself. Okay.
Hello. Hello.
Yes, we can hear you.
Yeah. So my question is that it is a challenge for a lot of women to identify the issues in the first place, that they exist, especially without a lot of awareness. Awareness, especially in this COVID times, is a dearth. There's a dearth of awareness. So are there any brief points that we can flag, like is there a checklist where we can see if there are mental issues that we need to address? Because a lot of times in the cultural norms and all, we brush off our feelings, we brush off our traumas, we tend to ignore them, which may manifest as much bigger problems in the future. So is there a certain uh, at least a small checklist, not if not a comprehensive one, to flag some major issues that might need immediate attention?
That's a very good question. So when any time there is, let's say, a situation, let's take pandemic, the COVID, for example, there are a lot of feelings and emotions that we all go through. And it is very important that we are aware of what we have. And it becomes very important to see, is it a normal reaction to a situation? Or is it severe enough that I need to seek help? And this is something which, all women, all over the world, both men, children, youth, everybody are thinking is this anxiety or the enough? Is it normal? Is it healthy? Or is it becoming so debilitative that it's not making me function? So when you look at the mental health awareness, it is very important that people know what are some normal reactions to stressful situations and what are the stressful reactions, which when it extends over a period of time can become severe. Because when you look at mental health disorders, we always classify them based on the number of symptoms as well as the duration of that particular symptom. So it is very important that people are able to, understand it. But in terms of self-checklist, I do want to be very cautionary when I say that we do not want to, determine that by ourselves without actual supports, because there is a tendency now with, the availability on internet, with all the different blogs that are going, that any person who goes and reads something, let it be even a health issue. If I go now and go and search something, I can actually diagnose myself with 101 disorders, both physical and mental. So it is very important that if you're facing something, rather than trying to see if I have one, it is very important that you have a general understanding of what mental health is, what mental illness is, what are some symptoms, and how long you're having it. Always go and check with someone who is a professional and seek their help before you try to do. But the awareness, and I think, is very pivotal, because if you are aware that you are going through certain experiences and reactions, always go and ask support. And that is what I would recommend.
Thank you so much, ma'am.
Thank you.
That was super helpful.
Sir, Subbu sir, please unmute J. Venkatachalam. Dr. J. Venkatachalam.
Okay. Sir, please unmute yourself. Sir, please unmute yourself again.
Yeah, thank you. Yeah, hi, Dr. Nandini. This is Venkatachalam from Psychology Department. I'm a professor of psychology and from Periyar University, Salem.
Hello.
And very nice session which you have taken from what I can say from east to west, where what you have addressed are the real problems faced by the woman, and which is very necessary to cope with the real pandemic situation, which is a nice session throughout, which was very nice with the examples which you have taken from the whole part of the world, which was an insight for me to learn something from this 1 hour session. Thank you very much. And it was a nice session. And I am also part of alumnus of SU University.
Oh, okay.
Thank you. Thank you for the nice session. And I thank Dr. Badramani for giving me this opportunity. Thank you.
Thank you, Chalam. Now, Subbu sir, please unmute Gayatri.
Ma'am, please
and
unmute.
Also Ramani, K. Ramani.
Gayatri, ma'am, please unmute yourself. Okay.
Good evening, ma'am.
Yes.
Ma'am, first of all, I'm very much surprised as well as very happy that you belong to our same batch, like not batch, actually the course IPSW. In fact, I am from IPSW. Like I was very much happy for that.
Yeah.
And regarding the session, I have a doubt like what kind of life skills should we, like, as students who have passed out, like we often face anxiety regarding our career issues, right? So what kind of things we should focus on to be better, or like to deal with these things like mental illness, because we often get how to say, away from the parents or whatever, like from the friends, like the things which we can't we feel insecure about, and even some issues related to career, ma'am. Like often we get anxious, so how to deal with those things?
Thank you. Thank you for your, I'm very happy that you're doing the IPSW course. I would say that that course is such a good combination because in my work here, if you see in mental health with our Indian population, the Indian culture, the IPSW, the psychology, social work, I'm actually doing using all the three in my work in the community here. And so it has a great future. I want you to first, feel relaxed about it. That yes, we make certain choices in life, and sometimes we question our choices, and a lot of times those create anxiety in all of us. And it's only getting worse, unfortunately, with the kind of things that are happening, in terms of competitiveness, in terms of opportunities. When you see that, gets very high stressful, and it's very, very common for somebody like you in that age group. And let me tell you, I experienced the same. We all experience the same when we are in that particular age group, when we make choices about what we study and what our future is going to look like, and when we have to make those. So a lot of times it is very important for you to rely on your personal strengths, develop your self-esteem and competence, and the ability to say that even if things go bad, I have these things to fall back upon. So look at your personal resources. As people from Indian community, the biggest strengths we have is that we have a family and social support system. So even if you move away from them, they are always there for you. So when you make choices which are not healthy, or which have been, for some reason wrong, there will be some emotional, reactions to it. But that doesn't mean that you have to look at yourself as a failure, or you have to, think that, this is the end of the world. But you always have to keep pushing yourself. And that is what we call as resilience, is the ability to bounce back even when things happen. So if you are experiencing anxiety, talk about that anxiety with people, let's say, who are your other students in your thing, saying, oh, do you also experience that anxiety, or is it just me? And the anxiety about future is always there. Believe me, it is there throughout your life. It doesn't have end just if you get a job or if you get married, because that's something as humans we think that when this is done, I'm going to be good. It doesn't happen. And now, as COVID has said, even the people who thought they were stable, people who thought they had everything, have now been impacted by it. So the whole idea I would like you to take is things will happen, but you have to develop the potential, the ability to bounce back and to keep going on, even if it gets harder.
Subbu sir, please unmute Lalita, K. Lalita.
Lalita ma'am, please unmute yourself. Okay. Unmuted, ma'am.
Lalita, are you there? Lalita. Lalita, you are unmuted and ready. Okay. She said that she is in a village and maybe there is some network problem there.
I think some network issue, ma'am.
Okay. Sushmita, please unmute Sushmita.
Hello, am I audible?
Yes, you are.
Okay, ma'am. I'm really happy to attend this session, and right from the topic that was chosen to every point that was covered into it, and the clarity and the deep knowledge in every point was so mesmerizing. I'm so happy to attend this session, and especially your way of presenting it was so good. One, the data that I got, and second, the way of presenting was so wonderful. There were two learnings for me today, so I'm very, very thankful for it. Thank you.
Okay, you're welcome. So I have a message that I was just reading about a question. Do you want me to address that?
Yes.
Okay, it says, what are some of the courses in psychology that we need to take for a career in Canada? This has been a question that I see on the chat. And I do want to say that the same things that we do, what everybody is doing in terms of, courses that you take, the path to mental health or a psychology work in Canada is very similar to what you do in India. We don't have to do anything that's different. It all depends on what kind of a path you want to take, because we all know if you want to be a psychologist or work in the field of psychology, it's a very, very big area. People can choose to work with schools, with children, with women, with, in hospitals, as health psychologists. So there is plenty of scope, and whatever you do, you will be able to, try to find something in that area. So be passionate about what you do, and you can always, pursue. We always know that there are different ways you can come to enroll in higher education, or you can come, as a work visa, or you can come as an immigrant. So there are different pathways to come to your country, and it again depends on what your focus and your thing is. But psychology as a field has potential scope in every aspect of our life, and I see that whatever you choose, I wish you all the best.
Subbu sir, please unmute K. Ramani.
Thank you, Badrumani and the team for arranging this wonderful informative session. Just now, I have put my question in the chat also. Madam, I'm a housewife and I have a question that do you think that the joint family system works as an antidote for mental health problems of women?
Can you please repeat it? I didn't get the first part.
Yeah, that is the joint family system. Does it work as an antidote for mental issues?
Well, that's a very good question, but based on the research as well as my own work experience, I would say that a family composition or the structure does not really have as much importance as the people who are in it. I have seen women who thrive mentally, or their mental health thrives when they are in a joint family system, because they have people to share with, they have people to work with, so they thrive on it. Then there are others who have difficulties, when it comes to relationships with multi-generation households. So we cannot tell clearly what is that particular structure that could be a problem, but more about the people and the dynamics between the people. So it is very important that when people see that it's helping you, it works for you. But if the joint family system and the multiple personalities and the roles and responsibilities are going against each other, resulting in distress within the family, then it is important for people to see how and what we can do to make it work. So eventually, when I work with many of the Indian families here, I always tell them that the solution is not to change things. The solution is try to see how we can work with it. But if things come to an extent where it's seriously harming every member in the house, or if it is even harming one person to an extent where they're not able to function, it is important to then look at the family structure. So I would say that, coming from a family from India, as well as seeing, families who are here, both nuclear as well as in joint, it is more about the dynamics and the relationships that happen within the family that is important. And sometimes you change one person changes the behavior, it impacts everybody else. So it is very important. But I do see that even in nuclear families, there is a high incidence of divorce rates among South Asian families. We also see that sometimes when people are living in joint families, it's lower. So I wouldn't really, come to a conclusion on the effects of the system as such, but I would rather focus on the people who are part of that system.
Thank you, Ramani and Nandini. Subbu sir, please try to connect K. Lalita, Kalapatapu Lalita once again, last chance, okay? Lalita? Lalita, are you there?
I see a question here in the chat room. Somebody
sure,
asking.
Go ahead, ma'am. Go ahead.
Somebody asking, is there a difference between mental health in Canadian women and Indian women? And as I mentioned before, there isn't. The studies conducted said that both the Canadian born as well as people who are immigrants have mental health issues. But it is what kind of mental health issues, when you look at prevalence in that, there could be differences in terms of what women face. But I do want to say that, it is highly prevalent in Indian women, and I work with many of them. Last year alone, I worked with 50 Indian young women who came to study in university here, and they had. Now, when it comes to the support, I would say that I wouldn't still call them as people who have a mental illness, but a lot of times you come for a particular, situation or a mental health issue, and then, you are able to get the right support, and you are not now classified as somebody with a mental health disorder. So I would say that it is very similar, but the nature and the presentation are very different for our Indian women compared to the other Canadian women.
Subbu sir, please unmute Hamera Khanam. Humaira Khanam.
Hello. Hello.
Hello.
Hello. Am I audible?
Yes.
Hello. Good evening to one and all. This is Professor Humaira Khanam from SV University. First of all, I would like to thank SPW Degree College and PG and Tirupati Tirumala Devasthanams for conducting excellent webinar on making women's mental health a top priority, opportunities and challenges. Yes, it was very excellent webinar, and I'm very happy to see Padmani ma'am as alumni of SV University, because I'm working in SV University as a professor. Very nice to see you, ma'am. And then excellent, really, it was very nice presentation, and it was very informative, excellent presentation, madam. I congratulate you, and I congratulate all the organizers, and I congratulate all the organizers and team members for conducting excellent webinar during this COVID-19. It is very useful to all women communities. Thank you very much, and a very nice presentation, Nandini ma'am. Once again, congratulate you. Thank you.
Thank you, ma'am. Is Lalita there? K. Lalita. She raised her hand. I think she is there. Just try for the last time. Subbu sir. Okay, Nandini, do you have any other questions in your chat box?
No, I can't see. As it comes sometimes when I'm talking, I don't see any particular questions. Yes. But that was very, very interactive, and I'm very happy that we have been able to share this kind of an interactive discussion.
Okay, shall I proceed to the last session of our program, that is proposing vote of thanks then? Okay, it is very overwhelming, the reaction of the participants, and also everything went on very smoothly. I'm so happy. Good evening, all of you. It gives me immense pleasure to propose vote of thanks in today's international webinar. At the outset, I express my deep sense of gratitude for the chief guest of today's webinar, Dr. Duvuri Jamuna, Vice Chancellor, Sri Padmavati Mahila Viswavidyalayam Tirupati, for taking time from her hectic schedule and gracing this occasion with an apt message. Thank you so much, ma'am. Second, I extend my heartfelt thanks to the resource person, Ms.Nandini Tirumala, for accepting and delivering an excellent talk as a resource person for today's webinar. The reaction from the participants is very positive, and they all loved it. And the participants' number is also very huge. Nobody left in the middle. That says that our task is fulfilled. It is fruitful. Thank you, Nandini, for giving an excellent message on this very important day. We are all proud of you for being an icon to our students and all of us and our younger participants. Next, I would like to extend my profound thanks to our Devasthanam Educational Officer, Sri Ramana Prasad Garu, and management of TTD for giving us permission to organize this international event. Thank you, sir. My heart goes out in thanking our beloved principal, ma'am, Dr. K. Mahadevamma, for her immense support and presence in organizing this event. Thank you so much, ma'am. You are behind me in every second and every minute of this event. Thank you so much. And you are there for all of us. We know all the departments feel the same way. Please continue to be so. Thank you, ma'am. I thank all my friends, colleagues, students, and participants from our college, as well as from other colleges and universities in various states of India for participating in this webinar and making it a grand success by your active interaction and very positive feedback. I am indebted to all of you. Thank you all and love you all, dear friends. I thank the organizing committee members, Dr. Umarani, Dr. Kulai Reddy sir, and Dr. Munirajamma for their thorough support and help in organizing this international webinar in a successful manner. My special thanks to Subramaniam Garu for giving technical support in organizing this webinar and making it meticulously perfect and beautiful. Thank you so much, sir. And now I ask all the participants to mute your audios and stream, okay, your videos for taking a gallery photo. Okay, please all of you come online and unmute your videos. Nandini ma'am, please be here.
Yeah,
we want a gallery with you.
Sure, yes.
For our memories,
Yeah. Thank you, Bhadramani Garu, because it's been a very great pleasure.
It is very memorable.
It was a very well spent morning for me.
Yeah, very sweet evening for us, memorable evening for us.
Yes.
Subbu sir, after you capture the gallery, please let us know.
Okay, ma'am. Okay. Okay, I'm done, ma'am.
Okay, thank you, Subbu. Thank you, Nandini, once again, and I thank all the participants and my friends, colleagues, organizing members, and my dear principal, ma'am, and my friends from other places, Ramani especially, she took her time to be here. Thank you, one and all.
Yeah.
Thank you, Nandini.
I just felt like I'm in Tirupati right now.
And we are in Canada.
Yeah, true. Thank you.
Thank you. Bye.
Bye.
The program ends with the national anthem now. Lalita is still there. I miss her so much. Lalita, I know you are not with us, but your heart is with us.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 जय